Welcome to today's Global Connections program. I'm Bill Miller. Today, we're going to be looking at the population issue around the world, which is extremely important. My guest today is an expert on this topic. Mr. John Wilmoth, a U.S. national, is the director of the Department of Economic and Social Affairs Population Division at the United Nations. He has had a distinguished academic career, lastly, as professor at the Department of Demography of the University of California at Berkeley. Mr. Wilmoth is the author or co-author of more than 50 scientific papers examining various aspects of population dynamics and population issues. Mr. John Wilmoth, welcome to today's Global Connections program.
Thank you, Bill. Pleasure to be with you.
I appreciate you being with me today, John. Let's start off with just briefly, I mentioned Department of Economic and Social Affairs, DESA for short. In 30 seconds, what does this vital agency do to help people around the world?
Well, the Department of Economic and Social Affairs focuses on different aspects of economic and social development. It covers a wide range of issues. In my area, we cover population issues and population statistics. There's also a statistics department that focuses on data for all aspects of development. There's a focus on economic development and social development, on public institutions, on the environment. It's really the place that brings together all of the issues around the package that we call sustainable development, which has the three dimensions of economic, social, and environmental. And it's the one place in the UN that brings together all of these issues in a single package.
It certainly does, and they're vital. They're absolutely vital to the people in the United States and around the world. Well, we'll put the website below. It's a long one, so we'll just put that in there in case our viewers would like to go to get more information. Well, let's talk before we get into a recent conference you just had. But there are two major events. Well, there have been more than one sponsored by the United Nations, and one was the International Conference on Population and Development. And that was a conference, a very important conference in 1994. What was the thrust of that particular conference, and why is it so important today?
Well, the 1994 conference was the third in a series of United Nations conferences on population that had happened in 1974, 84, and 94. And then there hasn't been another one like that since. But the general thrust of those conferences was to focus on the challenges presented by demographic change, the essential change in terms of the demographic transition towards longer lives and smaller families, and the consequences of that, which include a period of rapid population growth, followed by a period of population aging. And so understanding those changes and having some framework in which to guide government policies that are related to those changes. And one of the major conclusions or emphases of the 1994 conference was a focus on individual rights and choices. And while there may be concerns, collective concerns about demographic trends, the overarching priority for government policy should be, member states agreed that the overarching priority for policy should be a focus on individuals' rights and choices as they go through their everyday lives, in particular when it comes to choosing the size of their families, the number of children that they'll have, and when they will have them.
Exactly, most assuredly right. Now, the other event that we've heard more about recently is the 2030 Agenda for Sustainable Development, commonly called the 17 Sustainable Development Goals. And these were goals adopted in 2015, I believe, by the General Assembly of the United Nations to eliminate hunger, to eliminate poverty, to empower women, to preserve the environment, and just on across the board. They've been dealt a blow because of COVID and many other activities, political activities and economic activities and otherwise. But how important are the 17 Sustainable Development Goals that many, if some groups support all of them? You've got service clubs like Rotary International, Kiwanis, faith-based groups. You've got environmental groups, labor unions, private sector, just on across the board supporting them. But how important are they as they tie into your work?
Well, they're very important. They really provide the roadmap for global development from the UN's perspective, and they're much more comprehensive than, say, there were goals and objectives from the 1994 International Conference on Population and Development, but the Sustainable Development Goals adopted more recently are really a comprehensive plan for global development, focusing not only on human development and the traditional concerns around poverty eradication, hunger, education, gender equality, and such issues, but also everything else related to aspects of life that affect the quality of human existence, related to the environment, access to clean water, issues around inequality and the impacts of human activity on the global environment, whether it's on the land or in the air. All aspects of this are put together, and then there's also a focus on global governance and peaceful societies. And also on the financing that's required in order to make these sorts of changes happen. So that's why we have 17 goals in this framework, and across them, they really cover all aspects of development in a very comprehensive way.
Mhm. And they're all interrelated and they affect all 8.2 billion people on the planet. I hope that figure's 8.2 billion is still accurate.
That's what
It,
we have for, yeah, 2024, I think 8.2 billion. Yeah.
Okay, great. We're on the same figure. Well, great. Well, your office, as well, DESA in general, really does some great work. And one event that you had, I want to make sure I got it right. It was the 58th session of the Commission on Population and Development that just took place April 7th through the 13th at UN headquarters. What is that commission, and let's talk about some of there are so many issues there. We could spend 3 days talking about it, but pick out a few and we'll focus on those as to why they're important.
Sure. Well, first, what the commission is. The commission is it's a subsidiary body of the Economic and Social Council, which is one of the charter bodies of the United Nations. It's the part of the United Nations that deals with economic and social issues, and that it has several subsidiary bodies, including the Commission on Population and Development, which focuses specifically on population issues as they relate to global development. And the Commission on Population and Development meets every year in an annual session, and every year it chooses a theme to focus on in its discussions. And the theme for this most recent session, which took place last month, was ensuring healthy lives and promoting well-being for all at all ages. And that is essentially the same as the third Sustainable Development Goal on health. That's really the health goal is SDG 3. And the wording of the theme for this year's session of the Commission on Population and Development was almost identical to the wording of that goal. So the focus was on health and many different aspects of health across the life course, and how it interacts with development in across the board.
And it is certainly very important for all of us. And well, again, another issue that affects everybody on the planet. We certainly cannot avoid that. What did you have specific recommendations that came out of the Population Development Commission meeting, or were there just suggestions, or what was your final document, I guess?
Well, unfortunately, there was no final outcome document. This is a situation where governments do try to adopt a resolution on the theme every year, but often they encounter difficulties in coming to agreement. And there's a practice of only adopting a resolution if they can achieve consensus on the text of the draft resolution. And there was a draft put together. The chair proposed an initial version, and there were negotiations that took place over a couple of weeks. And after that time, the government still couldn't come to complete agreement. Just as things are very split these days in Washington, D.C., they're also split very much here in New York at the UN. There are strong divides between countries in terms of how they view certain topics. And this year, it was not possible to reach consensus.
Mhm.
But nevertheless, there was a lot of discussion in some of the key topics that you ask about. I mean, I think one of the main areas of focus is the question of universal health coverage or health care for all. There are various forms of this, but the need for social protection, and in particular the need for universal access to healthcare, was emphasized, and that, of course, is a difficult topic because it's costly, and there was some discussion about the financing of that and how to make that work. And that's related then to another process here at the UN that's happening this year. There's going to be the fourth International Conference on Financing for Development, which will look at these issues of financing, which really are key to the whole challenges of development right now in the world. It's a question of money, of course, and unlocking the financing that's available and channeling it towards the right purposes to ensure that all people have access to a basic level of social protection, and so that there's a minimum level of income for everyone, and food is available at least at a minimum adequate level, and that healthcare and education are available. These are really the fundamental goals of the UN under the Sustainable Development Goals. The first five or six are really focused on these just basic matters of human well-being, and health is one of them.
Mhm. And you mentioned the inability to come to some agreement. And I do remind people, and I don't know how many countries you had represented at the meeting, but there are 193 member states at the UN General Assembly, and they represent every population in the world. They represent every geographical area, every political system, every economic system, just on across the board. And sometimes it's difficult to get total consensus. But we're going to talk about that in just a moment when we come back. Well, you're watching Global Connections Television, which is a privately funded, independently produced program. The opinions expressed on Global Connections are solely those of the moderator and his guest. We invite our viewers to go to our website at www.globalconnectionstelevision.com to view previous programs. Also, if you're involved with a PBS or community access television station, or perhaps an educational institution that has an intra-campus television hookup, or you have a podcast, or you just have a computer, you like our shows and you would like to share them, please feel free to do so. Global Connections Television is provided at no cost as a public service to help us better understand international issues and how they impact our lives. Today, we're talking about a wide range of population issues that were covered at a recent conference at the United Nations. And my guest today is an expert on this topic. Mr. John Wilmoth is the director of the Department of Economic and Social Affairs Population Division at the United Nations. John, these conferences are extremely important. And I know even though some of the people didn't come to, or countries didn't come to an agreement, you shared an immense amount of information. And as you mentioned, the universal health care coverage, what can we do? What can countries do? The United States is desperately, in my opinion, in need of this, as are some other countries too. But what can be done to move this issue along? Because it, along with maternal and child health care services, have all been stymied somewhat or stalled over the past couple of years. What can we do to move off the dime and deal with topics that are vital to people's lives? Also, in many cases, are, I'm not going to say bankrupting, but are certainly putting an extensive economic toll on the budgets of the various countries with some of the systems they have.
Well, there's no doubt that healthcare is very expensive, and it's a major part of the budget of many governments. But when we talk about health, I think it's also important to recall that this is actually an area of development where we really do see quite substantial gains over time.
Mhm.
You mentioned maternal mortality. Well, there was a recent study that came out from the World Health Organization on maternal mortality estimates for the world, and It showed that the maternal mortality ratio, which is the number of maternal deaths, which are deaths during pregnancy or just after the birth of a child, that's the number of the maternal mortality ratio is the ratio of those deaths to the number of live births. And it's usually expressed per 100,000 live births. And that number has come down by 40% between 2000 and 2023. So, I mean, that's really a very substantial decrease over that period of time. But there are a couple of cautionary notes in that. First of all, the rate of decline has gone down in recent years. It's been slower in the period since the SDGs were adopted in 2015. That's become the period since then has been a period of relatively slow progress in reducing maternal mortality and in many other domains as well. So there's been a slowdown in the progress in recent years. And where we are currently is that we're not on track to achieve the goals that were established in 2015 for really across the board. But for maternal mortality, for example, the goal is to get down to 70 maternal deaths per 100,000 live births, and we're still over 200 globally. I mean, it's even if we accelerate progress over the next few years, it will be difficult to reach the goal that was established in 2015. So there is progress. I mean, it's important to remember that, but it's not as fast as we had hoped, and it has slowed down in recent years. So some effort needs to be made to accelerate all of that.
And it's important to take the long view of these issues and not just look at 1 year, or 2 years, or 5 years. But as you mentioned, there has been progress. And that's true in many areas with the Sustainable Development Goals, but they're extremely important. Well, there are other issues too that you may have had a chance to talk about, or maybe you didn't. But one, we've seen that there's a aging process underway, I don't want to say gentrification process of societies getting older and older. The Japanese have dealt with this. The U.S. is dealing with it to some degree now. And there's a real problem with providing healthcare workers. Did you talk about that? And do you have any suggestions in that area?
Well, the issue of healthcare workers, there are various issues involved. There's generally a shortage in many countries of qualified healthcare workers, and there are many factors behind that. The exodus from the healthcare profession during the COVID pandemic and afterwards has not helped. Many people have gotten out of that profession because it was so challenging, so difficult. Many countries try to address this by importing healthcare workers from other countries, allowing migration of healthcare professionals. But then this doesn't help the countries where they're coming from in order to maintain their health workforce. And so there's an attempt by the WHO to kind of set some standards on the criteria that should be involved in taking in workers from other countries and in encouraging circulation of those workers so that they go back to their home countries and so that there's some benefit for home countries as well as the countries where they are migrating to. But there's also then in our economy, there's a tendency to ignore in some ways the work that goes on in terms of care, often in the household, and often the care that goes into taking care of the older population, the effort that goes into taking care of the older population is not counted in our economic statistics. So there's a large uncounted portion of economic production that's involved in care work that's not counted and it's not acknowledged. And the people who are performing that work don't receive the benefits that they should for performing work in the economy. So some of the recommendations had to do with this issue of managing the health workforce and promoting, the exchange of work, the ability of people to move across borders to work and to, practice their profession in another country. That's generally supported, but somehow maintaining controls on it so that it doesn't deplete the workforce of developing countries is an important issue, as well as this issue of recognizing the work that goes on, the considerable work in the care economy that takes place that's not counted in our usual economic statistics.
Mhm. And those services are extremely important, very valuable, and as you said, are not counted, and they somehow or another should be, it seems like. Well, there are other issues that have come up. One is the universal access to sexual and reproductive health care. Did that come up, or did you discuss it to some degree?
Yes, that always comes up in the Commission on Population and Development. That's a very common theme because of the focus on reproduction and fertility, which is really the essential, the most important driver of population change is the number of births that happens every year. And over time, that's really what controls whether populations grow in size or whether they decline and or whether they become older. It's really very much affected by the stream of births that's coming in from year to year. And so reproductive health is a primary focus of the Commission on Population and Development. And as I said before, there's a general recognition by governments that the priority should be enabling people to have the families that they want to have, the number of children, controlling the number of children, deciding and controlling the number of children that they have and when they have them, and the importance of having the information that's necessary to do that. So information and means that are necessary to do that. So having access to means of contraception and information about that at the appropriate times in life.
Mhm. And these services are extremely important, and governments should be supporting them, as should private sector groups and others too, to help maintain their levels, but also to really help create this better world. And we see now that there's a cutback in so many services. If you look at just the United States, with well, basically almost the elimination of the USAID program and others that have been absolutely invaluable to people, millions of people around the world. So we need to have a more of a focus on this, hopefully in the future. One other issue that I was reading about not long ago, it was the non-communicable diseases as being one of our major problems. What is a non-communicable disease, and what can we do about it?
Well, non-communicable diseases, as opposed to those that are infectious or communicable, infectious diseases are those that are caused by some sort of microorganism that invades the body and causes disease. So there's a kind of known external agent that causes the person to become ill. Non-communicable diseases are those that kind of develop over time as a result of the slow chronic degeneration of the body, which occurs with biological aging. And so the non-communicable diseases they've become dominant as we've learned more and more to control infectious diseases. In the past, I mean, several hundred years ago, most people died from infection and accidents, and those were the most common causes of death. And more recently, communicable diseases, I think they now account for about 3/4 of all deaths worldwide. And this is the future. I mean, this includes things like heart disease, cancer, stroke, uh, dementia. These are the diseases of aging, basically. And most people now die from the diseases of aging. Well, that's in some ways a good sign. It means that people are growing to those older ages where those diseases become the most prominent. But the focus now needs to be more and more on uh, minimizing the risk factors that contribute to these chronic degenerative non-communicable diseases. So it's a lot of lifestyle issues, issues around smoking, diet, exercise, the things that help to keep people well, or on the other hand, to make them grow ill if they don't attend to those things. So it's very important. This is where focus on youth, because it's in youth that people develop such habits typically, and so there needs to be a lot of focus on encouraging positive habits young in life and then maintaining them throughout adulthood.
Mhm. Do we need to encourage people to do sort of a life course approach to dealing with these issues? We hear that education is a lifelong endeavor. You never outgrow your need for education, I guess, or to learn or to advance, that type of thing. Do we need to encourage this amongst people to help them deal with all these different issues and be aware of them and maybe develop some solutions to the problems?
Well, as people live longer and longer, lifelong education becomes more and more important. We shouldn't think of education as just something for the young. As workers continue, as people continue to work at older ages, they need to have the education and the skills that allow them to still be productive and useful. But also there are all these issues. There's this evolving knowledge about what is good for our health. And science is not static. Scientific knowledge develops and grows and changes over time. And what we considered possibly good advice a few years ago is not always the best advice today, based on the new knowledge that we have. One example is the role of alcohol, and there was a belief a few years ago, not that long ago, that small quantities of consumption of alcohol would be good for people. But the evidence more recently has been that really all levels of alcohol consumption are uh, not good for health. Maybe small amounts may not be very dangerous, but there's really no longer this belief that small quantities of alcohol consumption are good for health. And so, that evolves over time, and people need to listen and adapt their habits. For myself, I've pretty much stopped drinking as a result. I mean, I was never a big drinker. I was never a big drinker, but even I don't think of having a glass of wine with dinner as being a healthy thing anymore. It's an enjoyable thing, but it's not something that I'm doing for good health.
The scientific report came home to us, didn't it? It
Yeah.
certainly did. Well, John, you're doing some really remarkable work. And in the last part, I hate to hit you with this 20 seconds we have, the clock is not our friend, but what do you see as our biggest impediment? I know funding is obviously number one, maybe, I'm not sure. But what do you see as we deal with these issues that you're dealing with on a daily basis?
Well, I mean, funding is fundamental for addressing the issues that people really care about. But there's also I have a great concern about the kind of the cultural divide that exists in the world today, and we see it in the U.S. obviously, but with the recent election and all the situation currently in the U.S., you very clearly see this cultural divide, this political divide. And at the United Nations, we see it very clearly in the Commission on Population and Development. Sometimes I say it's the ground zero for the culture wars at the UN, because it's concerned with these issues around reproductive health, sexual health, migration, these things that are really driven by cultural and political differences. And we need to come together more as a world uh, and to understand each other's different points of view and be a little bit more accommodating of those different views. I think that's ultimately an important part of the solution.
It certainly is, and that was a perfect way to wrap it up. But John Wilmoth, I want to thank you so very much for a very interesting and a very informative program.
Thank you, Bill.
I'm Bill Miller. Thank you for joining us on today's Global Connections program.